Welcome back. Health departments like the one in Cleveland County are launching programs to combat the growing trend of opioid overdoses.
Well, joining us today to talk more about the impact drugs like fentanyl are having on our community is Drew Laboon with Country Road Recovery. Thanks for joining us this morning.
Hey, good morning. Thank you.
Let's talk about the impact, the rise in fentanyl addictions that you've seen this past year and years past.
Well, it's been huge. I remember when I first started in the industry in 2020. During 2020, we had ever one person that came in that had experimented or was addicted to fentanyl. In 21, we saw that number double and triple, and then in 2022, nearly all of our clients and all the folks that we work with in the industry have experimented with, either intentionally or accidentally, with fentanyl.
That's shocking to hear. Fentanyl, the smallest amount, can kill you. From an addiction standpoint, why are people willing to risk this? I've heard it's 100 times more potent than morphine.
Sure.
Why would you choose to put something like that into your body?
Well, there are two different categories, right? There are the folks that aren't intentionally ingesting fentanyl. Those are the fentanyl poisonings when those folks die. But the other side of that is being a person in long-term recovery. I can answer the question from that perspective, struggling with substance use disorder, is that I go through several different thoughts of I can't stop, for one, no matter how hard I try. And the biggest one is I don't think it will happen to me. I live in this world of that happens to other people. I'm blinded by this delusion that it'll never be me until it is. And I think that's what a lot of folks struggle with.
And you kind of have this idea that you're invincible at the time you're possibly using. What can family members do to maybe help their loved one out?
Well, I think awareness, right? The fentanyl overdose deaths that we've seen have shifted to a younger and younger population. So I won't guess your age. That wouldn't be polite or smart to do. But I know for me, when I was a kid, experimenting was much different than it is today. Kids that experiment today go and buy a pill or get a pill from a friend or something like that, and it's a lethal dose of fentanyl because it's a fake pressed pill. I mean, just in Norman, I saw you all's report this morning, they just did a bust where they found a bunch of fentanyl. The crazy thing is in 2022, we saw the arrests and busts double. Our law enforcement are out there grinding, they're hitting the streets, doing everything they can, but we also saw the overdose deaths double in the state. In 2022, overdose deaths killed way more people than COVID and car accidents combined. But we're not talking about this. We're not talking about how it is a mental health crisis, not a moral issue. It's a health issue. And we don't want to talk about it. It's too easy to live with our heads in the sand and say, oh, this isn't in my community, this isn't in my neighborhood yet, until it is. So and largely in the state of Oklahoma, we're very reactionary. We wait till it's on our front doorstep and then we react to something rather than being proactive, educating families, educating school districts, educating community leaders on the realities of fentanyl and how it's already here.
Drew, where would you direct families or anyone listening today for more information?
They can call us. We love to stand as a resource in the community. For us, well, of course, I'm partial to Country Road Recovery Center. It saved my life in 2019. But largely, we want to be a resource to the community. There's a lot of other numbers you can call. We really push and encourage to get naloxone, nasal Narcan, in every single home. It's free for Oklahomans. You can text naloxone to 55155 and they'll mail it directly to your house.
Wow.
And break the stigma. Know what an overdose looks like. Talk to your children. Make it less punitive and say, hey, listen, if you're struggling or your friends are struggling, it's okay to talk to us about this. Let's get help. Let's do the right things and treat this as the mental health crisis that it is.
Drew Laboon, thanks for talking to us. We appreciate you opening up as well.
Thanks for having me.